In this video, I'm going to show you how to bottle feed your baby without overfeeding them. We'll cover the basics of bottle feeding and discuss some tips that will help ensure your baby gets the right amount of nutrition while avoiding any potential risks associated with overfeeding. 1. How do I know when my baby is hungry? One of the most important parts of bottle feeding is knowing when your baby is hungry. Signs that your baby is ready for a feed include rooting around, smacking lips, crying, and turning towards the bottle or breast if you offer it. If these signs are present, then begin to feed your baby. 2. What position should the baby be in while bottle feeding? Bottle feeding should be done in an upright position. This helps prevent babies from taking in too much air, which can cause gas, burping, and tummy aches. It is best to hold the baby securely with one arm while supporting the bottle with your other hand. The bottle should not be propped up or placed in a reclined position. Doing so could result in overfeeding, as well as choking or aspiration risks if milk were to enter the baby's lungs. Make sure that you are always aware of how much food your baby is consuming during each feeding session and adjust accordingly. 3. How can I tell if my baby has had enough to eat? The best way to tell if your baby has had enough to eat is by monitoring their behavior. If your baby appears content and relaxed after feedings, then they likely have had enough. You should also pay attention to how long they're eating. When a baby induces vomiting or starts refusing feeds, it could be a sign that they are overfull. Additionally, your baby's weight gain can be an indication of whether or not they are being overfed. If you notice your baby's weight plateauing or decreasing despite regular feedings, it might be time to adjust their feeding schedule or the amount of formula you offer during each feeding. Lastly, the number of wet diapers can give you an idea of whether or not your little one is getting enough to eat. If you notice fewer wet diapers than normal, it could mean your baby isn't eating enough and should be given more formula or milk. 4. Should I warm up the formula before feeding it to my baby? Warming up formula isn't necessary, but you should make sure the bottle is body temperature before giving it to your baby. To do this, run warm water over the bottle until it feels slightly warm when touched. If you're using a pre-made formula, check the label for instructions on how much of the formula to give and how to warm it up. Test the temperature of the formula on your wrist before giving it to your baby, and be sure not to overheat it or leave it for too long in hot water, as this can cause bacteria growth. If possible, let your baby feed from a room temperature bottle, as this is usually more comfortable than a really cold one. 5. What are some potential risks associated with overfeeding a baby? Overfeeding a baby can have serious consequences, both in the short term and long term. In the short term, overfeeding can cause reflux and vomiting, which may lead to dehydration. Longer-term risks of overfeeding include infant obesity and potential problems with glucose metabolism. Additionally, babies who are regularly overfed might develop an unhealthy association between eating and comfort security, leading to future difficulties with weight management. To avoid these risks, it is important to follow safe bottle feeding guidelines and speak to a doctor if you have any concerns. 6. Are there any signs that indicate a baby may be allergic to formula milk? Yes, there are. The most common signs of a formula milk allergy include an eczema-like rash on your baby's face and body, vomiting after feeds, or excessive spitting up, or gasiness. If you suspect your baby is allergic to formula milk, seek medical advice immediately. Your doctor will be able to advise the best course of action. Switching to another variety of formula may help alleviate symptoms while maintaining adequate nutrition for your baby. While allergies are quite rare in infants, it's important to be aware of the signs so that you can act quickly if they occur. Seek out expert advice if necessary, and remember safety first. With proper attention and care, bottle feeding can provide the right amount of nourishment and nutrition for your baby. 7. Is there anything else parents need to consider when bottle feeding their babies? Yes, parents should always be aware of the signs and symptoms of overfeeding so they can adjust feedings if needed. Signs of overfeeding include spitting up more than usual, abdominal discomfort, increased irritability, and sometimes vomiting after feedings. If parents notice any of these signs, they should speak to their doctor or a lactation consultant for advice on how to properly adjust the amount being fed. Additionally, it is important to pay attention to any changes in your baby's weight. Too much or too little gain may indicate that something needs to be adjusted with bottle feeding routines. We hope that this video has been helpful in teaching you about the basics of bottle feeding and how to avoid overfeeding babies. Remember, it's important to keep an eye on your baby's cues and watch for signs of fullness when determining the amount of formula or breast milk they need. If you have any additional questions regarding bottle feeding tips, don't hesitate to leave a comment down below. We would love to hear from you. And if you enjoyed this video, be sure to subscribe so that you can stay up to date with our latest content. Thanks for watching.